Good morning, Keegan here. I've been talking with a few people about some sort of forum. I've had a few people encourage me to get some folks together and talk about important things in healthcare. I've done this a few times before where I gather people on a topic, and the beauty of these gatherings is that I don't have to be the expert. The whole point is to bring everyone together and create a community of experts in an area, because you become expert by learning. I can't get enough of learning. I also can't get enough of talking with smart people. So this has happened a couple times this week where a person here or there has said, Keegan, you did this before where you brought a community of people together to talk about a topic. Do you remember when? Do you remember when you did this? Do you remember when you did that? And I've also been longing for that kind of dialogue recently. So I think I might do it. Maybe it'll start with some short videos like this and then kind of expand into, I don't know, some Zooms and maybe something else. Anyway, there are some things on the top of my mind. One of them is value-based care in Medicaid. In particular, as I think about the way the market is evolving and areas that I've been working in. One example of an area I'm working in now is maternal health in the underserved communities. There's a huge number of mothers unnecessarily passing because of hypertension, for example. There are other examples of this, and I was out recently thinking, well, there should be, or where is the business model for the underserved, or where is the business model for health-related social needs, or where is the business model for Medicaid? Because we're always thinking about maybe more prominently Medicare and kind of the aging population and kind of forgetting about the rest. So there's plenty to talk about here, and New York State has a bunch of work going on, North Carolina, Oregon, some other states. So perhaps that's an area we could talk about. Also, of course, artificial intelligence and AI in healthcare, a lot of work going on there. And I think potential, we've done some work in this area before, been looking at text and narratives in healthcare, ways to increase efficiency. And I think there's some applicability to Medicaid there as well. So plenty to talk about. Hopefully soon you'll hear more from me on this. And if you're interested in joining, I'll put up a poll and see what kind of interest there is. Regardless, I'll talk more about it and we'll go from there. All right. Thanks. Keegan out.